If you've been doing all your shoulder stretches and strengthening exercises and you're not making any progress, maybe you've even gotten an injection, but the pain keeps on coming back. You could have limited shoulder range of motion, but nothing is working to improve it. What if the real cause of your shoulder pain isn't even in your shoulder? In this video, I'm going to show you how pain in your shoulder often comes from somewhere else, why traditional treatments miss it, and what actually works to fix the problem fast. Hi, I'm Stefani, owner of Empower Physical Therapy. We help people get out of pain without pain pills, injections, or surgery. And this is a common mistake we see all the time in shoulder pain treatments. Most medical professionals go straight to treating the shoulder and not look at other possible sources. 46.7% of shoulder pain comes from the spine, yet no one will rule it out. Let's talk about a recent client. So we had a recent client that came in that had tried physical therapy in multiple locations. The reason that she came in was because she was skiing. She wasn't even she was just standing and then happened to kind of slip and fell on her shoulder. She got an MRI and it showed that she had a Bankart lesion, which basically is the shoulder dislocates down and it creates in that bottom part of the shoulder down through here, where in the capsule down the bottom part, it'll create kind of a bone bruise from that, and you even can get a labral tear, which it showed on the MRI. Makes sense, she fell. But everyone went to the shoulder, cranking on the shoulder, doing everything for the shoulder, and she just wasn't getting better. But she was also getting some neck pain. And no one focused on this. No one focused on, okay, let's go and see where the source may be coming from. Because yeah, maybe the MRI shows that, but maybe it's not as big of a problem of what we think. So when we did her evaluation, she came in, her shoulder range of motion, she looked like this. Like she literally couldn't move it up very far. She couldn't go behind her back. It was difficult to go behind her back. It was difficult for her to rotate. It was difficult for her to bring her arm up like this. All very common things that you would find with a shoulder issue and with a Bankart lesion. When I tested her strength did not look that bad. It didn't look bad through here and through her internal external rotation. She didn't look bad through that bicep. She actually had, she was weak through her scapular muscles, but that's because she didn't have a lot of good mobility there, which is what people miss. So we went and ruled out her spine immediately, went and gave her exercises to start working on, took her through some neck stuff for traction extension and retested her shoulder. She didn't have that much improvement, had a little bit of improvement, definitely felt better. Her first rib was really tight. That's what was producing pain into that shoulder. So her just sitting there and having pain into the shoulder, which you think, okay, it's probably a shoulder issue, actually was coming from that first rib, from her protecting like this. So we keep her shoulders down. We went and mobilized her first rib. All of her pain went away from just sitting there, nothing. She only had pain if she kind of moved her arm up in those directions. So then we went into her ribs. She had no rotation. Down in that shoulder blade, especially in that bottom part of the shoulder blade, she had a lot of winging in that shoulder blade. And a lot of times when you get that winging, yeah, you could think, oh, it's a weakness thing. But in reality, for her, it was a mobility thing. Those ribs had pulled out so much that her shoulder blade was popping out to the side. So if I go in and I exaggerate my shoulder blade, this is kind of where it looked like. Her shoulder blade was off to the side because those ribs were pulled out so much that she couldn't physically get it back. So if I'm here, this is as far as I'm gonna go. I'm gonna butt up against everything. So if we can get the shoulder blade to come back, then my range of motion is gonna be so much better in all those different directions. So that's kind of what we did, was mobilizing those ribs. So stay to the end, and I'm gonna show you some of the things that we gave this client. What are common sources for having something like this happen? Man, the biggest one is if you have a computer job and you're in these prolonged postures, constantly kind of looking down on our phone. I know you hear me saying this all the time, but we're doing this all the time. If I'm like this rounded, what's going to happen to those ribs? They're going to kind of pop out here. And if we come out of that position, they can kind of go back in, but it's going to take time for them to reset. And if you don't have enough time for them to reset and you go back into those positions, it's going to give you problems over time. So that's the big one. Falls and injuries is another big one. And the big thing with this client, yeah, she showed like clearly there's probably going to be a shoulder issue. But as we've done her treatment, I'm like, I don't think you have a shoulder issue. I think when you fell, you probably rolled and it popped out some of those ribs a little bit that just got unstuck. And we just have to kind of mobilize them. But no one ever looked at that. She potentially would have had a surgery that then would have had even more pain because now she has a surgical pain and the pain from other things that are going on within those ribs. So how do you know if it's coming from the spine? How do you know that there's an issue in the neck or in the thoracic spine? Again, I said 47.6% of people that have shoulder issues, actually it's coming from the spine. Yet no one rules it out. So we've got to rule those kind of things out. So if you're getting like symptoms up and through here in your neck, then we know, and through here, we know there's a spine issue. We've got to look at that. That's a potential sign that there is issues within that spine. If we notice that you can't turn all the way, especially on the side that you have issues in the shoulder, we know there's going to be a spine issue. That was her case as well. She couldn't turn all the way. So there's already signs that were like, whoa, we've got to rule this out and see how much of her shoulder pain is actually coming from her neck. Pain with sitting. Same kind of thing. You're not even moving the shoulder, but you're sitting there and you're having some pain. Very common. That's what happened with this client. She was having pain even just sitting because of things that weren't moving in her spine. And the last one that is no clear injury. If you're not really sure what you did, man, that's a first sign like we've got to go and rule out the spine. Now this client had an injury, but she wasn't getting better with traditional PT because no one was looking at the whole big picture. So how do we treat something like this? Well, depending on kind of what's going on, we always clear the cervical spine first. And that's when you can go in and just take some baselines. If your shoulder looks like this and you're trying to move it and you can't move it, we've had people that have had rotator cuff surgeries and they still look like this 5 months after a rotator cuff surgery. I'm like, okay, we've got to rule out the spine. They barely had any, like no stiffness in the neck, all those symptoms that we just went through, they didn't have. Barely had any motion loss at all, but we went and took them into retraction extension and their range of motion improved like that. So you can go in and test your range, see what it feels like. Go in and do a few retraction extensions, do a round of like 8 to 10 of them and retest your shoulder. If it's like, nope, that kind of feels the same, then we start going into, we do a couple of rounds of those just to make sure, especially if you start noticing like some improvement, like that improved, but this didn't improve or this didn't improve. If there's any kind of improvement, we just do more reps and just see if it's more reps that we need to solve the problem. Because sometimes it's a reps thing. It's not like it doesn't work the first time, but by the second and third time, we're starting noticing results. So we've got to do some reps. If we're noticing a little bit of results, we just keep on doing more reps and seeing what happens there. Because that's a lot of times what it often is. People will get off doing something like that, doing the retraction extension. They'll stop too soon when in reality they just need to do more reps to get them back. So ribs. If ribs are the problem, we've already ruled out like the upper neck. Ribs are a problem because again, if your shoulder blade can't glide in like this because if my ribs are stuck out, the shoulder blade has to come down and in. If it can't, it'll roll out to the side. And that's where I showed you, if I roll out to the side, my range of motion is not that good. And we've got to improve that. So when people are super, super stiff, I'll use things like a towel roll because it's just going to be a little bit more comfortable because we'll find people are just going to be stiff as a board. And what you'll do is you can place it all along the spine. This particular person, we had to go more through that lower border of the shoulder blade. So we had to place it more in through here because that's where she had most of her tightness. You'll have your hands behind the head. If it's too much to do this, you can keep the hands in or the elbows in. And then you're just going to hang out here and just breathe and try to feel the stretch. Now, if it's too much of a stretch because you can't get back, you can make the towel roll a little bit bigger. So this one I can't make bigger, but if you have a bigger towel, you can make it a little bit bigger. You can also make it a little bit smaller if it's too much. You've got to be able to breathe and relax into the position. Otherwise, it's not going to work. If it's too much, then your body's not going to be able to relax into it. But if it's too little, then you're not getting any benefit from it. So you need to have a discomfort of probably like a 3 to 4 discomfort with it. I kind of say it like feels kind of like a stretchy pain. Maybe not at the very beginning, but as we work through it, it ends up feeling really, really, really good. So that's how you can do it. If the towel roll doesn't work, then you can use a foam roller. This is only when people have a lot more mobility, because this will hurt if it's too much too soon. So again, what you can do is you can kind of come through here. You can have the elbows here. It's a little bit different. Going backwards to kind of open up the ribs. You can have the elbows here. Works a little bit differently. Out to the side and just kind of hanging out. You can kind of do movement where you go through it to do some movement. Or you can kind of hang out there. A lot of times I have to hang out because if you're really stiff, you really need to stretch that joint. If you can't find it on the roll, you can always kind of roll up to kind of feel it through here. You can also roll down to feel a little bit more. So it's easier to roll when you use the roller. Now sometimes I have to get it a little bit more into that shoulder blade, and it's a little bit harder. So what you're gonna do is you're gonna take the end of this and you're gonna butt it up against the shoulder blade. So you'll feel it. If I come here, I can feel like there's my shoulder blade. I don't wanna be on the shoulder blade. The shoulder blade will stop some of the mobility. So you can take it, if you're not feeling this is the last phase of doing this exercise to progress it. You're gonna rotate towards that side and extend. And you're gonna definitely feel it through there. Because you're really hitting the one side that is not moving. So you'll just kind of hang out here. You can again do a little bit of movement. You can hold it. They're all very different to start working on getting that mobility back. So again, you go through and test it, and then you come back and just kind of test the motion of the shoulder. And if you're noticing like, wow, this actually feels a whole lot better, my movement is better, we just need to keep on doing it, and we've just confirmed that a lot of your shoulder issue is coming from your spine. Now, with that being said, there's times when there's a neck component or a thoracic spine component, and there's times when the shoulder doesn't feel like it gets a lot better, but there's like maybe it gets 90% better, 80% better, but that last 20% doesn't. That's when we have to go into the shoulder and do some shoulder stuff. And that definitely does happen. And if you're noticing that you're not quite getting there, it's sort of getting there, this is a great time when you just come in. You got to come in to find someone that understands the body, because they're going to pinpoint it much faster than what you can, because they've seen it. We're like the coach of your body. We can coach you through these things so much faster than what you can do on your own. But these are great starting places for people. If you found this helpful, hit the like button and share it with someone who is always complaining of shoulder pain. And if this keeps happening and you've tried everything without relief, this could be a sign of a deeper issue in the spine or in the shoulder. We specialize in helping people feel their best. So click on the link below to schedule a discovery visit or sign up for our free report on how to get relief with your neck and shoulder pain. Don't just live with it, fix it. You deserve to feel good and stay active.